It's the 1800s, and the Industrial Revolution is changing everything. Cities are growing faster than ever before. Steam-powered factories are replacing cottage industries and steamboats, and trains are shrinking the world. People in Europe and North America are making more money, but it's a different story across the pond. Back in London, things are starting to go horribly wrong. You wake up in your small apartment. It's hot, stuffy, and you can barely breathe. You were feeling sick yesterday, and now you're freezing cold. Your breathing is labored, and you call out for your mother, who hustles over to stroke your forehead and calls the doctor. After one look, he prescribes you mercury, a treatment proven to be highly effective against the disease you're infected with, but with a huge risk of poisoning. This was the reality of life in the mid-1800s. Things weren't good, and the world of medicine was a scary place. So what happened? What was life really like back then? And how did the world escape the darkness of Victorian medicine? The late 1800s was an exciting time to be alive. Scientific progress was being made at an astounding rate. In 1862, the first telephone call was made. 8 years later, the first practical incandescent light bulb was presented, and the world marveled as the internal combustion engine was invented. But as these discoveries were being made, most of the world was still stuck in the dark ages, at least when it came to healthcare. Things started going downhill for Londoners when the Industrial Revolution transformed the lives of millions. Before factories, most people worked at home, producing goods for local markets. But as mass production took off, skilled artisans were replaced by machines, and goods were produced at a scale never seen before. People flocked to cities, looking for better opportunities, and London grew exponentially, going from 1 million to 7 million people in just over 100 years. As cities became more crowded, unsanitary, and filled with pollution, diseases spread quickly. Water wasn't safe to drink. Surgery could kill you. And people were constantly exposed to toxic materials. Medical science had yet to make sense of germs, and despite people working hard to advance their understanding of the human body, there was a lot of nonsense being passed off as legitimate healthcare. In fact, there were dozens of treatments that were commonly practiced in the 1800s that would be considered outrageous today. One of the worst things about living in the 1800s was the fact that you could easily die from something as simple as a cut. Back then, surgeons believed that wounds should be cleaned with copious amounts of mercury, no matter the cost. Mercury has been known to cause tremors, muscle weakness, and an array of other neurological problems. And that was just the beginning of the madness. Throughout history, opium was used as a painkiller and sedative, and in the 1800s it was easily available. However, no one knew exactly what the substance was, as it was typically imported from Turkey and sold through a variety of merchants. In the Ottoman Empire, opium poppies were heavily taxed, so the quality varied depending on where it was sold. Often it was laced with other substances, and it could be completely impure. This meant that taking opium could have a range of negative effects, including death. Doctors were willing to put patients to sleep with this dangerous drug. However, in some cases, they would use it as a method of treating depression and mental illness. You might be wondering why people didn't just avoid treatment if it was potentially fatal. During the 1800s, people had few options when it came to healthcare. The main alternative to going to a doctor was relying on herbal remedies and folk medicines, and many of these treatments were equally as bad. While undergoing surgery, you could ask to have laudanum, a concoction of alcohol and opium, to dull your pain. However, this was a risky move as it could put you to sleep, and the surgeon could end up operating on you while you're still conscious. This happened on multiple occasions, and was a very traumatic experience for the victim. And if you managed to survive the surgery, you could end up dying from an infection because the instruments hadn't been sterilized. Some doctors had begun to realize the importance of cleaning instruments before operations, but the idea was far from universal, and you could easily die from a simple operation. If you were unfortunate enough to have a doctor who didn't sterilize their equipment, some of the most common ways to treat illness in the early 1800s included purging or bloodletting. This involved inducing vomiting or diarrhea or removing blood to balance the four humors. The theory was that everyone was made up of four substances: phlegm, black and yellow bile, and blood, and that disease was caused by an imbalance. This was seen as the best way to eliminate disease, but it actually weakened patients and made them more susceptible to dying from other causes. During the mid-1800s, leeches were used as a form of treatment. Leeches could suck blood out of a patient and therefore remove impurities. They were also used to treat headaches, joint pain, and other ailments. Some leeches carried diseases, and this led to more sickness. Now, let's talk about the greatest killers of the 1800s. Smallpox, cholera, and tuberculosis claimed millions of lives, leaving entire communities decimated. Smallpox killed an estimated 300 million people in the 20th century alone, including many prominent figures like King George II. Back then, the only way to prevent smallpox was to catch it early and then cover the affected areas with milk and pus from another person who had the disease. This treatment sometimes worked, but many died from the effort. Eventually, a vaccine was developed in 1796, and it saved countless lives. Cholera is a bacterial disease that comes with violent stomach cramping and watery diarrhea. It's spread through contaminated food and water, and it can kill a person in hours. The symptoms were so terrifying that it was rumored to liquefy a person's insides and kill them. In 1832, cholera arrived in London and killed over 14,000 people. The peak of the epidemic occurred between August and October, and the death toll continued to rise until it slowed in December. Throughout the 1800s, cholera came and went in waves, killing millions each time. Tuberculosis is a bacterial disease that mostly affects the lungs, but it can affect other organs too. Symptoms include coughing, fever, chills, weight loss, and fatigue. A person can be contagious for months or years before they begin to show signs of infection. Sometimes a person who has tuberculosis can go into remission and reactivate the disease later in life. This means that TB was a problem throughout history, and it continues to be a threat today. There were other outbreaks of disease in the 1800s, including the bubonic plague, yellow fever, typhoid fever, influenza, and polio. All of these outbreaks threatened to wipe out entire populations. And although there were attempts to treat or cure them, there were few answers. Treatments for these diseases ranged from bed rest to bloodletting to quarantine. The problem was that doctors didn't know how to properly diagnose a patient, and without knowing what was wrong, it was almost impossible to develop a cure. Finally, it seemed like the medical community had figured out some of the mysteries of the human body. Doctors began to understand the importance of cleanliness, the dangers of letting blood out of a patient's body, and the need to sterilize instruments. The last thing people wanted to hear was that washing your hands could save lives. But it was true. Ignaz Semmelweis noticed that fewer people died from infections when doctors washed their hands. It took a while for the idea to catch on, but eventually it was accepted and lives were saved. In 1847, Dr. Elizabeth Blackwell became the first woman to graduate from medical school in the United States. She paved the way for generations of female doctors, but she also opened a new door in the medical field. Scientists began to specialize and focus on particular aspects of the body, like the nervous system or the circulatory system. They created new instruments to view parts of the body that had never been seen before, like the brain or the heart. Vaccines were developed for smallpox, cholera, and other deadly diseases, and public health measures were implemented to prevent the spread of infectious diseases. The future looked bright for medical science. But there was still a long way to go. Life expectancy at birth in the United States today is just over 78 years, but back in the 1800s it was just under 40. And with so many people dying young, there was still plenty of room for improvement. So what do you think? How did life in the 1800s compare to life today? Let us know in the comments below, and don't forget to like and subscribe for more videos like this.